Hi folks, I got a question for you. I'm sorry, I guess I missed this. This is from Mrs. F. Sorry about that. I don't know why I missed your question, but here's your question. I sent in a question a while ago. Sorry. My daughter sucks her finger. When and how is a good time to try and stop that? Thanks. Okay, I apologize again. I don't know why I missed it, but telling a child to stop sucking her thumb is like telling a guy to stop smoking a cigarette. You know, you say, hey, stop smoking, and he says, why? It makes me feel good. So it's the same story with the kid. You're not going to be able to pull the thumb out or the fingers out because it makes them feel good. So the question is, do you have to really do anything short of gentle redirection or positive reinforcement when she's not doing it, or just gentle reassurance? Those are the general rules. So the question is now, when do you have to intervene? When is it the point when you come to the point that thumb sucking is wrong or detrimental? So there are two main reasons when you probably have to start doing something about it. One is that they're approaching age 5 and still sucking their thumb. That's one sign. And then the other sign is that their teeth are starting to get misaligned. And from the thumb or the fingers, it starts to make the teeth have an overbite or protrude more. And you think, well, it's not a big deal because it's a baby teeth, but the formation of the baby teeth will help determine the formation of the adult teeth. So if you can help prevent misalignment now, it may save you $4,000 to $5,000 down the road in orthodontics. So once you establish whether it's to that point or not, and you need to establish that by either having your office look at your daughter's teeth to see if they're becoming misaligned, or taking her to a dentist, and the dentist can make that determination. So like I said, two different scenarios. So let's take the younger child with the teeth misalignment. What can you do about that? There are a couple of things you can Google and find, but they don't necessarily work. One is the fingernail polish that is supposed to deter them from sucking their thumb. You paint it on their finger or thumb, let it dry, and then when they put their finger in their mouth, it tastes yucky, so they don't want to suck their thumb anymore. That's the theory. But it doesn't necessarily work. They just lick it off or drink some water and then go back to sucking their thumb. There's nothing bad in that fingernail polish. In fact, it's usually like a cayenne pepper, something that's hot, that theoretically would work, but it really doesn't. The other thing is they have little thumb gloves that the kids wear, and it prevents them from getting their real thumb in their mouth, but they still suck on their thumb. They just get the glove wet. The other one is, they used to call them no-nos, because in ICU you use them to lock the kids' elbows so they can't pull out the breathing tube, but they make these too so the kids can't get their thumb in their mouths. But then they can't itch their noses and they can't rub their eyes, and I don't know, that's more of a frustrating way of preventing them from sucking their thumb. Maybe the more reasonable ways that would produce a solution, one is a dental device, where a dentist places the device in the teeth, and it has pokies on it, so they're very sharp. So every time your child puts her thumb in her mouth, it pokes them in the finger, and they don't want to do it, so they put it in and it hurts them. They say, son of a. Then they try again, suck their finger, oh, son of a. So they can't poke their finger. That's a little bit primitive. But then there's another device, dental device, that is attached to the teeth, and when they try and suck their thumb, they just can't press it against their palate to suck on it. So there's no satisfaction to them because this device prevents them from getting the traction to suck on their finger. Again, first you have to decide if it's that severe, then you need somebody to look at their teeth, and then you need to figure out the intervention. So that's the younger child. Now the 5-year-old plus who's still sucking his or her thumb, the question is, why is this happening? Is this part of a bigger picture? Does he or she not sleep well? Does he or she not do well in school? Are there a lot of temper tantrums? Is there issues with eating? So is there a bigger picture? And does this child need some counseling? I don't know. I'm throwing out the extreme cases, but thumb sucking, once it starts to get past 5 to 6 years old, then there may be something else involved. Anyway, that's the summary. In general, the idea of the thumb sucking is to pacify them. It makes them feel better. If it's not detrimental to them, again, then I wouldn't do anything except just general reassurance. But if it is causing some detriment, then it's time to make the diagnosis of it being a detriment and what you can do to intervene. Thanks very much. Again, I'm sorry I missed your question. Have a great week.